Welcome back to my channel. Today we will talk about very high yield microbiology modules for the USMLE, and actually this kind of it's a rapid review and the kind of clues that helps you uh, gain few easy points on your test day. Okay, so without further ado, let's dive in. Let's talk about first with the fried rice. Okay, I'm sorry, I'll mark. Okay, let's start with fried rice. Okay, suppose the question is mentioning about reheated rice, okay, or the rice that has been left over and then again it has been heated, then we need to think of bacillus cereus. Okay, but if that is the symptoms has occurred within 6 hours, okay, then we need to think of staph aureus. Okay, if there is like picnic food, mayonnaise, pastries, potato salad, then we need to think again with staph aureus. Okay, if there is mention of poultry, eggs, then we need to think of salmonella. If like uncooked hamburgers, we need to think about hemolytic uremic syndrome. Okay, like the person has consumed uncooked hamburgers and now is presenting with bloody diarrhea, we need to think of hemolytic uremic syndrome, and that is actually classic for E. coli, and this is very important. This strain 57H7. Okay, so we need to think about this. If it is like raw seafood or seawater exposure, we need to think about Vibrio species. Okay, if there is like recent antibiotic use, okay, if there is like recent antibiotic use, we need to, followed by diarrhea, we need to think of clostridioides difficult. Okay, if like there is a person has gone to camping and then now present and has drank water, okay, suppose river water they have drank and then now is presenting with foul smelling diarrhea, then we always have to think about Giardia lamblia. Okay, that is very important. Okay, and then suppose the person is presented with like appendicitis like symptoms, okay, we need to, that is pseudoappendicitis. Okay, we need to think of Yersinia intercolitica. Okay, this is also very high yield. Okay, suppose now we talk about like in AIDS patient, like in immunocompromised patients, like in AIDS patient, the patient is presented with chronic diarrhea. Okay, in such cases we need to think about cryptosporidium. Okay, and suppose if the patient is presented with like fever, weight loss, anemia, then with chronic diarrhea, we also need to think about Mycobacterium avium complex. If the case is of sheep hoarders, okay, and the and in the USC, if we are seeing liver cyst, okay, we need to think of Echinococcus granulosus. Okay, suppose if there is like raw undercooked pork and the patient is presenting with muscle ache, okay, and if there is like muscle cyst, if we see muscle cyst, we always need to think about trichinella. Okay, these are very high yield. We need to this we need to think about trichinella. Okay, Trichinella spiralis. Okay, now if suppose the patient is, now let's move to hematology. Okay, if the patient has sickle cell disease, okay, and there is a plastic crisis, okay, or a plastic anemia, even in that we need to think about virus, that is it's parvovirus B19. Okay, I'm sorry for that, it's parvovirus B19. Okay, so we need to think about parvovirus B19 in these cases. Okay, suppose in osteomyelitis, most common cause is staph aureus. Okay, suppose in like osteomyelitis there is puncture wound, now osteomyelitis, greenish pus, then we need to think about Pseudomonas aeruginosa in these cases. Okay, suppose patient is sickle cell anemia and there is osteomyelitis, we need to think salmonella. But still, what is the most common cause of osteomyelitis in those cases also is staph aureus. Okay, we need to think that too. Okay, so not just salmonella. We should not be thinking only salmonella, but the most common cause of osteomyelitis, even in sickle cell patient, is still staph aureus. Okay, suppose if there is like ring enhancing in CNS, like ring enhancing brain lesion in, suppose in AIDS patient, we need to first think about Toxoplasma gondii. Okay, but we also need to keep this CNS lymphoma due to Stern-Barr virus as the differential. Okay, we need to think that too as a differential. Okay, suppose like in this temporal lobe encephalitis, we need to think about what it is a HSV1. Okay, so these are important. Now suppose there is like torch infections. Okay, triad, like the patient has coronary retinitis, hydrocephalus, intracranial calcification, then in those cases we need to think about what? Toxoplasma. Okay, so these are even in pregnant female, and there is like catfishes, we need to think about Toxoplasma. Okay, now suppose there is periventricular calcifications like sensory neural hearing loss, there is petechial rash, we need to think of cytomegalovirus. Okay, suppose cytomegalovirus, we need to think as it is periventricular. Okay, periventricular. In cytomegalovirus there is V, right? Whereas in toxo it is not. So there is toxo, there is intracranial calcification, whereas in CMB there is periventricular calcification. That is also one important way to remember this. Okay, now then suppose there is congenital cataract, and there is patent doctor's arteriosus, blueberry muffin rash, we need to think about rubella. Okay, we need to think about rubella. If there is like some like if the patient is from California or Arizona, then and presented with fever, cough, night sweats, we need to think about coccidiosis. Okay, now if there is like bat, Ohio, River Valley exposure, then we need to think about Histoplasma capsulatum. Okay, so these are basically from the area. Okay, we also need to remember the area. Okay, in which area these histococcidiosis are prevalent. Okay, we need to remember those. Suppose if there is atypical pneumonia and there is positive cold agglutinin, then we need to think about Mycoplasma. Okay, these are very important. Suppose if there is current jelly sputum, okay, in alcoholic patient, we need to think about, like even if current gel is not written, okay, it's like red gel like structure in the sputum, then in alcoholic patient mostly we need to think about Klebsiella pneumonia. Okay, suppose for the this for skin and soft tissues infection, like, okay, suppose in burn patients. Okay, let's talk about burn patient. In burn patient, if there is like green discharge, green pus, then we need to think about Pseudomonas. Even if there is no green discharge, we need to think about like burn related infections, malignant external, this otitis externa, we need to think about Pseudomonas aeruginosa. Okay, whereas like for the honey crusted lesions, we need to think about Staph aureus. Okay, and again there will be Streptococcus pyogenes also for that, but these questions will be directed, like there will be given other criteria to differentiate Staph aureus and Streptococcus pyogenes. Okay, suppose let's say there is dog bite, cat bite, we need to think about Pasteurella. Okay, Pasteurella multicoida. Now let's talk about what is left. Okay, suppose there is like fried rice with, okay, suppose there is honey. Okay, suppose there is like a patient has taken home canned food, or even infant has taken honey, and then there is like flaccid paralysis, we need to think about Clostridium botulinum. Okay, if there is like nail puncture, and then there is a history of nail puncture wounds and now presented with spastic paralysis. Okay, or even like Rhizus sardonicus. Okay, with Rhizus sardonicus we need to think about Clostridium tetani. Okay, or if there is like we talked about diarrhea, but like after diarrhea the patient is presented with ascending paralysis. Okay, after this diarrheal illness, then what we need to think in such cases, we need to think about Campylobacter jejuni. Okay, so Campylobacter jejuni. Okay, so okay, suppose there is like if there is written like, okay, there is white discharge from the vagina like cottage cheese like, and we see like germ tube formation, then what is this? This is candida. Okay, candida albicans. We need to think of those. Okay, like suppose there is like jaw infections or oral infections, there is drainage, and we see branching gram positive rods, then we need to think about, in those cases we need to think about actinomyces. Okay, actinomyces is really okay. Suppose I think I'm done. Okay, sorry. Okay, suppose if there is deli meat, soft cheese, okay, especially in pregnant patient, we need to think about listeria. Okay, suppose if there is like after few the patient is getting pneumonia, then we need to think about staph aureus. Okay, post viral is maximum staph aureus. Staph aureus can also be in IV drug abuse like IV catheters, even ulcers, surgical drainage side, there is ulcers, surgical drains, then in that cases also we need to think of staph aureus. Okay, suppose the person has come from meeting and now has pneumonia, like water aerosol, cruise, okay, flights, AC, then we need to think about legionella. Okay, suppose if there is isodase tick mentioned, then we need to think about anaplasma or borrelia burgdorferi. Okay, so these are the things that we need to remember, these are the buzzwords. Okay, suppose if there is parrots, then we need to think of chlamydia psittaci. Okay, if like cattle, sheep, then we need to think about Coxella bonneti. Okay, if there is like armadillo, okay, if there is something like that, then we need to think about Mycoplasma leprae. Okay, if there is like water, urine in water, okay, something like that, river, then water, then we need to think about Leptospira. Okay, I think I have covered maximum buzzwords, but there are still many more. If you want more, please do comment so that I can upload more microbiology buzzwords. For today, I think I'm done. If you train yourself to recognize these like buzzwords, instantly you won't have to like reason through microbiology on your test day, and you will simply recognize the answer and move on. But still you need to look to the other clues. Okay, sometimes there can be written like gram positive, gram negative, or there can be other descriptions also, but we can narrow down with these buzzwords too. Okay, so these are very important, very high yield. Please remember these buzzwords so that you can easily narrow down your answers and gain point on your test day. I hope this video is useful, helpful. Thank you so much. Keep signing, keep studying, keep preparing, one step closer to your mass day. Thank you so much and stay blessed. Bye bye.